next speaker is Dr. Manzer Hassanein. He's going to talk about local regional control after breast conserving surgery for T1 and T2 lesions, a 5-year retrospective study at NCI. تفضل.
Good evening, everyone. My name is Dr. Manzer Ahmed Hassanein. I'm a surgical oncologist in the Ministry of Health. The study in hand is assessing local regional control after conservative mastectomy for T1 and T2 breast cancer patients, 5-year retrospective study in National Cancer Institute of Cairo. We all know that breast conserving therapy is now the main thing for early lesions for breast cancer, constituting breast conserving surgery, either quadrantectomy or any wide local excision with any kind of reconstruction, followed mandatory by radiotherapy, plus minus adjuvant systemic therapy, chemotherapy, or hormonal therapy, according to the hormonal status, nodal status, and the size of the tissue. Study in hand had an objective to assess the different influential factors affecting the local regional recurrence and the overall survival from January 2006 to December 2011. In this period of time, 223 patients were diagnosed with early stage breast cancer. Only 187 patients met the inclusion criteria. We assessed different prognostic factors affecting the outcome of the patients, either patient's factor, treatment factors, or pathological factors. The main factors that affected our results, or that we found affecting the overall survival and our recurrence. Local recurrence happened in 21 patients, 11%, which is quite large compared to the other studies and other centers worldwide. 27 patients, 14% died during the follow-up. The median overall survival for 70 months, while the median local regional recurrence-free survival period was 60 months, nearly 5 years. The overall survival was mainly influenced by the delay of surgery, more than 1 month after the diagnosis, which was quite shocking. And the p-value was 0.024 because some of the patients were delayed more than 3 months and had very worse overall survival. Other factor, the presence of positive axillary lymph nodes lowered the overall survival with a very significant p-value, 0.002. While the number of the axillary lymph node, positive axillary lymph node, had a worse overall survival and had an effect on the overall survival with a very significant p-value, 0.001. On multivariate analysis, positivity of the axillary lymph node had a hazard ratio of 3.3, which is quite significant, and a p-value of 0.007, while the delay of the time of the operation from diagnosis to more than 1 month had a hazard ratio 2.7, which is quite significant too, with a p-value 0.04. The local regional recurrence was affected mainly by the positivity of axillary lymph node. Any patient that did conservative mastectomy with a positive lymph node had a higher instance of local regional recurrence with a p-value 0.004. While omitting adjuvant hormonal therapy for the hormonal receptor positive patients had a very bad impact on local recurrence and had a higher instance, 0.004. On multivariate analysis, positivity of axillary lymph nodes on local regional recurrence had a hazard ratio of 4.5, which is quite significant with a p-value of 0.003, while not receiving hormonal treatment for hormone-positive receptors in cancer patients had hazard ratio 3.7 and a p-value of 0.003. Conclusions: the local regional recurrence was mainly influenced by the positivity of axillary lymph nodes and omitting hormonal therapy, which is quite significant. And the overall survival had an inverse relation with the number of positive axillary lymph nodes and the delay of surgery, more than 1 month after the diagnosis. Thank you.
Thank you, Dr. Manzer, for this short talk. It's very conclusive, and I think we have 2 minutes for any question if anyone has a question. Okay, thank you, Dr. Manzer. Thank you.